Hello, everyone. It's Monday, August the 30th. I'm kind of echoing here. Is that okay? Monday, August the 30th. We have 20 additional deaths since the last time we were together on Friday. In addition to that, we have 7 additional deaths that are reconciliation, where we're, finally getting the official death certificates in. I'm going to read through every one of these, but, on Friday I sit with you and I tell you there's going to be more and more and more that die until we really, really aggressively getting more of our people vaccinated. The 3,055th death in West Virginia is an 83-year-old female from Kanawha County. The 3,056th death is a 77-year-old female from Fayette County. The 3,057th death is a 68-year-old female from Cabell County. I hope everybody's really paying attention to this. The 3,058th death is a 35-year-old female from Monongahela County. The 3,059th death is a 60-year-old male from Monongahela County. The 3,060th death is a 78-year-old female from Braxton County. The 3,061st death is a 44-year-old male from Randolph County. The 3,062nd death is an 88-year-old female from Fayette County. The 3,063rd death, a 91-year-old female from Wood County. The 3,065th death, an 80-year-old male from Ohio County. I've got a double up here. The 3,066th death is a 69-year-old male from Cabell County. The 3,067th death is a 57-year-old female from Logan County. The 3,068th death is a 94-year-old female from Raleigh County. And now to go do the reconciliation deaths that we've missed. The 3,069th death is an 86-year-old female from Wood County. The 3,070th death is a 59-year-old male from Berkeley County. The 3,071st death is a 61-year-old male from Kanawha County. The 3,072nd death is an 80-year-old male from Marshall County. The 3,073rd death is a 76-year-old male from Hancock County. The 3,074th death is a 66-year-old female from Cabell County. The 3,075th death in West Virginia is a 75-year-old male from Pleasants County. We have 1,141 new positive cases since our last update. Our positivity rate, daily rate, is 11.77. Our cumulative rate now has jumped all the way to 5.19. We have 16,372 active cases in West Virginia. Our recovered cases are about 170,000. We have 579 patients that are hospitalized and 181 patients in the ICU units. The entire state of West Virginia, with the exception of two counties are yellow. Every other county is either orange or green. We have 20 outbreaks in our schools in 13 counties. We have a lot to look at and be concerned about. There is only one way. There is only one pathway out of this. There is no other pathway out of this other than to be vaccinated. Now, with all in us, we are trying beyond belief, and you'll hear this in just a second, to allow to get permission from those, the powers to be on the federal government side, to be able to give the booster shots to people that really, really, really need it. And I'll show you in just a second the math that will lead you to know how much they need it. I remind you very, very quickly here that if you're 65 and older and you have any kind of feeling of sickness, go get tested. The antibodies will absolutely save your life. Now just think about this. This is in all, this all, comes right back to the booster shots. The booster shots. Today, of those that are hospitalized in West Virginia, right now, 82% of those that are hospitalized with a COVID situation are unvaccinated. We can really change that, can we not? We can really move that needle by getting our folks vaccinated. But now get this, over the last 60 days, and this is why we need the booster shots in West Virginia so badly, 26% of the number of deaths in the last 60 days, 26% of them have come from underlying health conditions, and meaning that people in West Virginia have many underlying health conditions, heart disease, diabetes, whatever it may be. From that, a great amount of these people are vaccinated. Their vaccinations are wearing off. We're seeing the math absolutely move and tell us we need to be giving these people booster shots. And we're pushing the federal government as hard as we possibly can. We have not got them past the finish line. I understand wholeheartedly that they've got a lot on their plate. This Afghanistan situation is a total, absolute disaster. And I can't feel any way except it is no one's fault but our own, and absolutely it is a crying shame. It is a crying shame, how much, sacrifice so many people have done, especially all those in our military. And absolutely to look at what's going on there, it is absolutely a shame beyond belief. I mean, that's all there is to it. But now we have a situation here too. We need to get our people our booster shots now. And we cannot get the federal government to move. Oh, man. We're announcing another program today, and you'll hear this from General Hoyer a whole lot and everything, and this is about our grand families across West Virginia. There's approximately 35,000 of them, and we're going to try to reward them a little bit. We're going to offer a $150 school voucher to all of our grand families who get themselves and their grandkids vaccinated. This is an effort really more directed just at our kids. But if you're a grand family and the grandparents have been vaccinated and everything, and you'll just help us get the kids across the finish line and everything, we'll give you $150 and everything. And it's a way to get to help with some school supplies, and registration will begin next Tuesday on September the 7th. And Bonnie Dunn, who runs the Healthy Grand Families program, is joining us today. She's going to talk in just a second, but this is a way of, remember, the saving our wisdom. That's our grand families, saving our wisdom, and this is saving our wisdom. This is the grand families that we're saving our wisdom so that they can save our youth and save our future. So if Bonnie's on, if she'd like to talk just a second, that'd be really good.
Governor, thank you so much. This is a really big announcement for the grandparents who are raising grandchildren in West Virginia. The Healthy Grand Families program is going into its 7th year, 3 years in a pilot from 2015 to 2018. And then when we got the whole state trained, because our initiative is in every county of the state of West Virginia. And this is thanks in part to the legislature and what the funding that was given to us to get the state trained and have a point of contact in each county in the state. For people who are not familiar with this, every county has a county coalition for healthy grandfamilies, and General Hoyer will be posting that information so you will know who to contact. But initially what our program is about, it's services. We are about advocacy, we are about intervention, we are about being a point of contact, about showing where grandparents can access resources that they did not know they had available to them, and a lot of them are through DHHR. There was a little cartoon that came out some time ago, I think on Facebook, and it was a little child asking the grandmother about the scar that was on the side of her arm. And she said, "Oh, that's my smallpox vaccination scar." And the child said, "Well, why don't I have one?" And Grandma said, "Because it worked." And that's exactly what we're trying to say to grandparents. You know, you quoted a statistic of 26% of these individuals who had passed away had underlying health conditions. During the pilot project that we had of 125 cohorts, every one of them presented with a chronic illness that had been professionally diagnosed by their physician. So we know that the grandparents who are raising grandchildren are not totally well. They are battling some kind of a chronic illness. And of course, in West Virginia, as you indicated, Governor, it's heart disease and diabetes and hypertension are the three top ones. A lot of them, though, were chronic pain. And I can't imagine being in chronic pain trying to raise a grandchild, or as many as 7, which we had grandparents in the program that were raising 7 grandchildren. We really and truly are looking to our coalitions in the counties to have some community programs where they can invite the grandparents out, talk about the importance of immunizations and vaccinations, and particularly the COVID vaccination. And maybe we'll get you and Baby Dog to go out and greet some of them. But this is so important, because one thing that I want to mention is that in the mix of all these grand families, we're looking at about 19,000 children in those families. What if our grandparents began dying off due to COVID because they didn't get vaccinated? What would we do in West Virginia with 19,000 homeless children? And we know that our foster care system is already on overload. This would put such a burden on our state and on our society as a whole. So it's very important that we look at this. And I want to give a personal testimony. I am a product of a grand family, which was not a prerequisite for me doing my job. It was kind of a divine intervention that this initiative fell into my lap. But my grandparents, I will never forget. I grew up in Rand. We walked 3 blocks to my elementary school to get the polio vaccine. This was important. My grandparents wanted to keep me safe and well as themselves. So, you know, that was back in the early 1950s, and it hasn't changed any today. So our whole goal is to encourage our grandfamilies to get the family as a whole vaccinated. We want you to stay healthy and happy and well so that you can continue to raise these grandchildren until they become functioning adult citizens. But I want to thank you, Governor, for your kindness and your heart for the family unit. This is near and dear to my heart, obviously, for the reasons that I have mentioned. I just felt privileged by being raised by my grandparents. They had an 8th grade education. They saw to it that I got 2 degrees. They were there with me every step of the way after they had raised 7 children of their own. So grandparents raising grandchildren is very important to me. And I believe it's important to you, Governor, and to this state. You've demonstrated that by providing these resources to the program. And I really thank you for this today.
No, Bonnie, thank you for all you've done. You just keep on keeping on and doing great work, and we could never thank you enough. And, I thank you for your testimonial, about being raised by grandparents and everything. It's, they are unbelievable. And it's just great work by great families. And, before I go any further, I want to say just one thing that she just said, and if you were paying attention to Bonnie, just think about this. Of those families that are out there, 19,000 kids are with those families. Now, if we'll just step back and just think about this just a second. We initiated a program called Save Our Wisdom. And along the way, we have continued to lose more and more and more of our elderly, have we not? She said, what if we were to lose these grandparents to this dreaded disease? You've got 19,000 kids in West Virginia that wouldn't have a home. These kids at the school or wherever they may be could very well be bringing this right back to the grandparents too. We need these kids vaccinated really, really badly, because the truth is just as straightforward as it can be. Bonnie could say, what if we lost these grandparents? We've got 19,000 kids that they've got that would have nowhere to go. Now, with all that being said, just think about just this. She said, what if we were to lose these great grandparents and great families? And we're doing it every single day. Every single day. I read to you name after name after name after name where we've lost more and more and more of our wisdom. Bonnie says, what if we were to lose? And I'm saying we are losing. We're losing them. We've given out 7,000 doses over the weekend, or since last Wednesday. It's not enough. We crossed past 1.1 million people, and that's great, in West Virginians that have had one shot. But absolutely, without any question whatsoever, it's not enough. It's just plain not enough. We have got to get more and more and more of our people vaccinated. We've crossed another threshold. We've got 91.4% of the 65 and older. That's great. But we just crossed 85% of the 50 and older, and that is absolutely amazing. We're at 71.9% of our total population now, and it's getting there, but it's too slow. And as we're getting there and it's too slow, we keep reading death after death after death. We've got another campaign that's going out just in the next few days and everything, and it's Do It for Baby Dog Round 2 campaign. The biggest thing about this is we're going to be giving away, I think, a total of 30 full ride scholarships to any institution in the state of West Virginia for kids that are ages 12 to 25. And this scholarship is a 4-year scholarship. It's room and board, it's books, it's tuition, it's everything. And so, that's what really tickles me. I love the kids, and I love all West Virginians, but I love the kids more than good sense. I know that. We're also giving away, a luxury sports car and some ATVs and some fishing boats and even a dream wedding and on and on and on. Season tickets to all sports at Marshall and WVU and lots of different stuff. Lift tickets, to all of our 5 ski resorts in the state, and just good stuff. But the bottom line to the whole thing is just another effort to try to get people vaccinated, to try to stop this death call every time I come in here. Every time I come in here, I'm reading the lottery of people that really and truly just won the death lottery, and you know, we just need to stop it. I told you Pfizer was FDA, you know, fully approved. You know, as far as our booster shots, we're ready to go. The second that we can get the go-ahead, we'll take off, and we'll just get doses in arms all over the place, from our local pharmacies to our National Guard, local health departments, healthcare facilities. We'll be ready. You know, we have led the nation, and we led the nation getting out of the gate. And now we need to lead the nation with our booster shots. So we're just going to continue to push in every way. I am not convinced whatsoever at this point in time to do any mandates. The eligibility is 12 and older. You know, the natural immunity is not good enough. At least it's not good enough for what we know today. Our young people that are 12 to 35, we need our grandparents and our parents to help get them across the finish line. All the COVID information's up on our website. You know, all the get testing information's up. I want to always thank Walgreens and Frith for what they've done. They've been really great partners. We now have 43 outbreaks in our long-term care facilities, 6 outbreaks in our churches. Those church counties are Barber, Doddridge, Kanawha, Mason, Taylor, and Wayne counties. You remember just the other day we went down to 1 inmate case in the state of West Virginia. We've got 104 now and 46 staff cases. I encourage you over and over about giving blood. You know, as far as also we have put the state into a state of preparedness. You know, from the standpoint of this Hurricane Ida that's probably going to dump a bunch of rain on us. We got to be ready for that. And West Virginia in a bunch of areas could very well get as much as 5 inches of rain, maybe even more. You just don't know. And with our mountains, that can turn into a bad situation. So be on guard, please. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar. I think we're having a small connection issue with Dr. Marsh. Let's try retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Again, would like to reinforce a couple of things that the governor pointed out. Statewide, 82% of those COVID patients hospitalized, 82% are unvaccinated. He also pointed out that over 74% of the folks who we have lost, great West Virginians, in the last 60 days are unvaccinated. And we know that those who are in that other category tend to be those folks with significant health conditions. We continue to press. The governor has tasked Dr. Marsh and I to stay engaged at the federal level. Tomorrow we have a discussion with the Surgeon General of the United States, and we will continue to press the governor's message that we must have booster doses immediately. We cannot wait in West Virginia. We also know that today and tomorrow, the Advisory Council on Immunization Practices will meet at the national level, so we hope we will have some more clarity from that. But again, also want to thank the governor for his efforts with our grand families. Having worked the emergency response piece in the state for years and working the opioid addiction issues, understand the significant importance of what the governor's initiative is of not just saving our wisdom, but saving our wisdom who are saving our future. So we will work hard to work with those groups to make sure that we get more grand families vaccinated. Thank you.
Thank you, sir. Next is Secretary Bill Crouch with the DHHR.
Good morning. I also want to thank Bonnie Dunn and Healthy Grand Families for just a wonderful job over the years and the partnership that we have with them with DHHR. So thank you, Vine, for your hard work. Very much appreciated. The governor continues to push DHHR to be transparent and to provide more information to the public and to everyone with regard to how we're doing with this pandemic. Today, we added a tab on the dashboard for breakthrough data, which shows cases and deaths along with age groups. We also added a drop down in the navigation labeled Other Trends, one of the tabs, which includes two options: case and lab trends and other trends. The case and lab trends tab shows the current 7-day average and previous 7-day average and death line graph. We also added on all graphs a 7-day moving average. We adjusted the 7-day tab to include percent of age groups. And lastly, we updated the vaccine summary tab to add a 7-day average to the line graph. And we also added a pop-up box to show totals administered and 7-day averages for the 7 days. So we appreciate the hard work of our folks. Done a terrific job. We had a little glitch this weekend, a technical issue. We started updating the dashboard again on Saturday and Sunday with cases and some of the current active cases information and testing. So we're moving to provide that information again on a 7-day basis, so folks have a better idea what's going on over the weekend. So thank you all. Thank our staff very much for their hard work on this.
All right, thank you, Secretary. Dr. Anam Jad, our State Health Officer, is also joining us today and is available for questions. Dr. Clay Marsh, our coronavirus czar, will rejoin us on Wednesday. We'll now go to questions from members of the media. Our first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. As someone who was raised in a grand family, when our house burned down when I was in junior high, we moved in with Grandma Wilma and Grandpa Herb and lived with them for 5 years until I graduated from high school and went to college. Me, my little brother, and my mom. So very aware of how important grandparents are. And thanks for the initiative to help those guys out, Governor. There is a doctor from Johns Hopkins who is quoting some of the latest data from Israel. And among the data is the efficiency of natural immunity, which has turned out to be several times more effective than the vaccine in protecting from COVID. Now, the doctor is also advocating for the vaccine and social distancing and masks. So this is in no way an anti-vaccine question. I've had two and I got a booster. So I'm all in on the vaccine. But the question is, with all the hesitancy we're seeing across America, in West Virginia, in different states, this doctor is suppositioning that in the beginning of the pandemic, it was almost like a political cue that came down from the top down, that the vaccine was the only way to fight COVID, while now it's showing that natural immunity actually, if you have it, is more effective than fighting COVID, than fighting COVID with the vaccine. And when we hit with that message and then went with no masks because masks were in shortage, and then use a mask when masks and more supplies became available, that more people then fell off the wagon. So what we lost trust. We lost trust in our government. We lost trust in our medical officials. We lost trust in the message. And Governor, I think that's what you're dealing with now, at least partly with people who are hesitant. So how do you regain that trust personally? How do you regain that trust as administration, as a state? How do you get these people online with you and run into the fire with you where vaccines are concerned, when so many have already made up their minds because of things which could have been avoided if this had been approached in a much different way in the beginning? Thank you.
Well, Kenny, let me just say this. You know, I do believe that the people of this great state have put an incredible trust in me, and it's an honor beyond belief, and I believe that for the most part, the overwhelming majority of the people are right with me because they know I've told them the truth, and that's what I'm going to continue to do. I've been as transparent as I know how to be in every way. I have never, ever told them anything except the very best of my knowledge that I can possibly tell them the truth. You know, you're exactly right, though, Kenny. There are many people that are out there that do not trust, especially our federal government. And our federal government continues to jump all over the place as far as, you know, Tom Floyd in South Carolina, the guy we lost that was really, really good man and a good friend, especially a good friend of my son's. And Tom used to say they jump from pillar to post, and that's all there is to it. You know, they jump the way the politics and the wind blows. We know how polarized we are at the federal level today, you know, from the standpoint of, you know, it's all about Republican and Democrat nonstop, you know, and it's a crying shame. We really don't know the dependability, and we have become a nation that is absolutely lost its trust in many ways. Now, as great as America is, we cannot continue to go down the path of not telling people the truth and absolutely losing more trust. You know, when the Johnson & Johnson scare came out, you know, from the Biden administration, really in regard to, oh gosh, we've got to stop doing, you know, the Johnson & Johnson vaccinations, and then we turned right around and went back and said, no, it's okay, we can do it. Well, you know, there's all kinds of situations that come out and everything. You know, in the very beginning, we don't need masks. You know, from Dr. Fauci, we don't need masks, and we need masks, and we don't need masks, and it's been a moving target. You know, I want everyone to know that all those people, if they were making those moves out of goodness and truth, then they're absolutely forgiven in every way. If they were making those moves to get elected or whatever it may be, you know, then I don't have much room for a whole lot of forgiveness there. You know, but with all that being said, you know, Kenny, the bottom line to the whole thing is just really simple. And people need to always understand this, and I know you get this, you know, in every way. But the risk of taking the vaccine is almost nothing. The absolute upside of having the vaccine is off the chart good. We do know without any question whatsoever that absolutely the more people that take the vaccine, less people will die. So it's just as simple as that. There's almost no risk to take the vaccine. There's absolutely a big upside. And absolutely, whatever you may think, you know, the only way we're going to really curb and stop these deaths, the only way, is for people to be vaccinated. And so, with that, Kenny, all I can do is come out here in front of you and plead and tell you the truth. 7,000 were vaccinated since last Wednesday. 7,000. That's a lot. That's an awful lot. I know it's not enough. And I know it can't stop this. And I know in order to be able to stop this, we've got to have a lot more. I don't know what else I can do. I don't know what else I can possibly do. But I'm going to keep trying.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I had a question about how the current surge is impacting the other areas of the hospital system and our healthcare network. I know that as of this morning, you know, we have close to 600 people statewide hospitalized due to COVID. Is there any indication at this point that this has begun to impact, you know, other elements of routine care, elective procedures, people seeking care? Thank you.
Charles, General Hoyer is going to take over, but Charles, you're dead splitting the bullseye. You know, what's going to happen here, just as sure as I'm sitting here, is things that we really need to be doing in our lives, you know, whether they be elective surgeries or whatever they may be, even to the point of emergency situations, whether it be stroke or heart attack or whatever, as we continue to push our hospitals to the limit, we're going to have a big problem there. But anyway, General Hoyer, go ahead.
Thank you, Governor. So, Charles, you make a great point, as the Governor pointed out. We have challenges. So what we have done is regularly, Dr. Amjad, Secretary Crouch, Dr. Marsh, and I stay in touch with the leaders of our hospitals. One of the things that we have done differently this time is to let hospitals manage more of the flow related to their COVID cases. So that allows us to do a better job across the state of making sure that we still have the resources available for those who are in most need and most risk. We do have a couple of cases where hospitals have already reduced elective surgeries. So there are people who are being impacted by this. And I've said this a couple of times before, unvaccinated people are taking up vital space in hospitals that may very well impact other people's health care. And Jordan, I think you may have the latest graph that just came out. So this was just updated while we came on the air. So you can see now that number is up to 640. So we have to get people vaccinated, as the governor pointed out. And I just, again, would say from an editorial comment, neither Governor Jim Justice or retired General Jim Hoyer are asking people to do this, as is Dr. Marsh, Dr. Amjad, Secretary Crouch. We have nothing in this other than to let people know this is the best thing that we have. And I go back to Kenny's comment. If that study, I believe, still has not been fully peer reviewed. Dr. Marsh and Dr. Amjad school me every day on the medical piece of this. But also, as the governor pointed out, with the health conditions that our population have, if we just waited for people to get natural immunity, our death rates and our hospitalizations are going to be out of control. Thank you.
All right, thank you, Charles. Next is Stephen Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Two questions. First question will be to General Hoyer. Since you have the new updated hospitalization number, I didn't know if you had the new ICU bed number for today as well. And the second question is for the governor on this. There's a small handful of lawmakers. I don't know how many, but I know there's at least 4 that I'm aware of that are either trying to get you to call a special session or call themselves in the special session. We'll see if they are able to get the signatures they need to do that in order to try to pass laws either prohibiting vaccine mandates or prohibiting mask mandates in the future. It seems like it's a small group of lawmakers on kind of the far right of things, but I wanted to get your take on some of that movement that's going on. Thank you.
Stephen, while the general's getting that, if you got that, General, you want?
Yes, sir, Governor. It is today. The latest number came in while we came on the press conference. It is 203 individuals in the ICU.
And back to your second question, about lawmakers wanting to call themselves in. If they want to call themselves in, they can call themselves in, from the standpoint, of where I'm at. I have stood firm as far as not putting out any mandates from the standpoint of masks or vaccines or, compelling anyone to do anything at this point in time. I'm trying with all in me to not doing anything that is going to just prompt more division. I think what we should be advocating in this state from our legislature standpoint, we've given the school systems, local control for them to be making decisions, about our kids and everything, because the local people should know better, and everything. We're trying to work with everyone as very best we possibly can, But what we should really be getting from our legislature as a whole is get yourself out there and get yourself vaccinated. You know, we don't need division, but if they want to call themselves in, they can surely do that, and there's nothing I can do to stop it.
All right, thank you, Steve. Next to Mark Curtis with Nexstar Media.
Good morning, everyone. I have a two-part question, and I think Bonnie Dunn might be able to answer the first part and Dr. Amjad the second part. Of the 19,000 children who are in grand families in the state, do we know how many of them are between the ages of 12 and 17 for vaccination eligibility? And the second part of my question to Dr. Amjad is, where are we at, or where is the federal government at in the process, and are we getting any closer to lowering the vaccination age limit to 10 years old?
Bonnie, if you're still on, maybe you can do the first part, you know, but, and then Dr. Amjad, you got to do the second part.
Governor, Bonnie had to drop off, but Mark, we don't have that number immediately in front of us, but we'll get that number for you.
And for the second part, Mark, we don't have a clear indication, but we're hoping to hear something soon, hopefully in the next couple of weeks. But we don't have a clear indication of that timeline for the younger age group for the vaccine yet. But hopefully in the next couple of weeks, we'll get some indication for that. Thanks.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, you made mention that we do have a big storm heading our way. I wanted to ask you about what sorts of preparations are being made. Are you pre-positioning some resources that can be used in case of flooding? And do you know when you're going to know how bad it's going to be? Thank you.
Paul, you know, I guess we're ready from the standpoint of the National Guard is working on pre-positioning people and assets right now, and so we're all over that. You know, they're always on top. You know, our emergency management people are on top of everything that we're trying to do, and in the situations that could very well, happen, and they're monitoring it hour by hour, and I'm very confident that they do a heck of a job. It was Paul, is that correct? Paul, you know, if you'll just step back from it and just think just this. At one point in time in 2016, it began to rain, and it was raining so hard, it was unbelievable how hard it was raining. And it wouldn't quit. And it just kept coming and coming and coming. Highly unusual situation, highly unusual. And it just kept coming, and it was just absolutely wouldn't stop. And in that, in just a matter of a very, very, very short few hours, we had a catastrophic situation going on in West Virginia. You know, so Paul, we'll watch, but I can promise you that while we think we know and we'll be prepared as best we possibly can, we really don't know. And so we're going to stay on top of it as best we can, and we'll be ready.
All right, thank you, Paul. Next to Kira Fry with WDTV.
Yeah, hi, this is a coworker of hers. She had to step out for another interview, but she's working on a story today. There are some schools in our area that are kind of waffling back and forth when it comes to mask mandates and remote learning, and not a lot of notice is being given to families. Would a state mandate on those sorts of things help create some consistency and make it easier for parents to kind of prepare?
You know, it's a real toss-up question, is it not? But I really believe that at this point in time, the local officials know the very best as what's going on in their neighborhoods and in their communities and everything. They know what is best. And I know that, you know, that everybody is just, you know, at times, nobody wants to make a decision, and everybody would just love to see a decision come, you know, from the governor. But in this situation, really and truly, do we not need to be making the very best decisions that we can make, and one size does not fit all? You know, the bottom line to the whole thing is just as simple as what I go back to. And I know you get tired of me saying this, but I'm just telling you the truth. The absolute no-brainer is get vaccinated. Get vaccinated, and we can stop this. You know, us going around and being concerned and worrying about mask or not mask, you know, that really isn't even the issue, is it not? It is not even the issue.
All right, thank you. Next to David Beard with the Dominion Post.
Hi, and before I get to my planned question, I want to ask a quick impromptu follow-up to Steve's question about the special session that the legislature could theoretically call itself into. If they would manage to do that and pass some kind of anti-mandate bill, I imagine that would tie the governor's hands some. So would you be inclined to veto that? And then my question that I planned on was if you could refresh my memory somewhat on what will happen with this booster program once the federal government okays it, whenever that is. I believe it's the Pfizer vaccine that would be the booster. And I know not all the data is in on how long the Johnson vaccine lasts. So would you be offering that Pfizer booster to people who've had all three vaccines, or only those who've previously had Pfizer? Thanks.
Well, I can do the second one real easy. I think absolutely it's all three vaccines, you know, but David, it was David, correct? Okay, but David, in regard to the legislature calling them back into session and everything, like I said, I don't really have any control over that. I don't think that they'll do that and everything, but they may, and I think it's completely premature on how I would feel, you know, if we come up with something like you proposed. I think the governor needs to be the governor, and in this situation, I have absolutely, you know, and I stand by what I've done. I stand by how the people feel. I have tried with all in me to lead us through this thing. I am very proud of the job that I've done, and I am continuing to do just that. And you know, and I think I'm pushing the right buttons, and I think I am, you know, riding the razor blade as best you can possibly do it right now.
All right, thank you, David. Next to Kelsey Soto with WSAZ.
Good Monday afternoon, everyone. We're hearing reports that parts of the southern U.S. and including our state are dealing with issues with oxygen supply. I was wondering if General Hoyer could kind of give an update on the hospital situation in that regard and some of the hurdles we're up against and what happens next.
General, please.
Yes, sir, Governor. So, Kelsey, right now our hospitals have told us that they are effectively managing oxygen supply, but they do have concerns that what is going on in the other southern states will eventually impact our access to certain supplies in number of days of availability. So we continue to work with the Hospital Association on a variety of ways that we can manage that effort. And your question is a great question and points out what the governor tasks us to do every day is we've got to be looking out at these challenges that we know are coming towards us and be prepared to address those as best we can with available resources.
Dr. Amjad's got a clarification on the boosters and everything. Maybe, you know, that's something we've made a mistake in saying, but if you could give us that clarification, please.
So the Pfizer is the one that's been, you know, FDA approved right now. So if you've received the Pfizer dose, you do need to get the Pfizer one again. The governor was right in stating that Johnson & Johnson has not been approved by anything right now. And if you've gotten the Moderna one, you should get the Moderna one again. So right now, if the booster one's approved, you should get Pfizer again. But Moderna is likely going to give some announcement. We're hoping Johnson & Johnson has been said they're going to give some announcement, but right now it's the Pfizer one that's been approved for the booster right now.
All right, thank you, Kelsey and Dr. Amjad. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, panel. My question is for Secretary Crouch. So I'm looking at the new Breakthrough Data tab, which has a lot of good information on it. But I'm looking at the sort of center portion where it has the age breakdowns, and there's one tab that says not fully vaccinated cases. I was wondering if you could explain that. Does that mean if someone has received one dose, or if it's just everybody that hasn't received their full series? Because when I look at the numbers, they seem like they're not exactly adding up. So just an explanation on that would be great.
Okay, Secretary Crouch.
Yes, June, thank you. That does mean that folks have had one dose or no doses. And that's probably why that's a little difficult to understand. We might try to clarify that with a footnote. But that includes individuals who've had one dose or no doses. So those are breakthroughs for that category of individuals.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, I'll be pretty short and sweet. You know, at the end here, I think I loved Bonnie's comment when she said that, you know, that the scar on people's arms, you know, a lot of those people like myself, you know, represent, you know, something that was done a long time ago to stop smallpox. And really and truly, the bottom line is those people paid a sacrifice in many ways to be able to shut that down and save all kinds of lives, and that's the reward of our younger people today. You know, 640 hospitalized and 203 in the ICU units, and probably others out within our state that are not well. We're going to continue to read death after death after death if we don't get ourselves vaccinated. Death after death, we've got to get ourselves vaccinated, and we've got to do a heck of a lot better than 7,000 since last Wednesday. That's good, but we need to do a lot better. Now, I've got a young lady that is our Secretary of Tourism. She has done an incredible job. Her name's Chelsea Ruby, and she's got some really good news to report, and we want Chelsea to be able to do that at this time. And but what a job! I mean, you know, really the bottom line, what a job she does, and always the truth's in the numbers, and West Virginia's numbers on tourism are absolutely shooting through the roof. And so again, Chelsea, take over. Great job. Great job.
Some exciting news to share with you today. So last week, U.S. Travel held their annual meeting. So this is where all the folks in the country who do travel promotion come together. And West Virginia received the highest honors in 2 categories. So Governor, I've got these beautiful awards here for you today. I'll hand them to you.
Okay.
I'll tell you what they are.
All right.
So the first one is
I'll leave them here with you for right now.
All right. So the first one is for community building. So community building is one of the 16 categories that they look at. It's how we work with our industry partners. And in particular this year, it was how are we responding to the pandemic? So we were recognized for the Place I Belong campaign that we did at the very beginning of the pandemic last year on social media. So we're very excited about that one. The second one is for our state travel guide. So as you know, every state does one of these, and we were recognized with the very best one in the country. This one, again, was a response to the pandemic. We took all the travel trends. We made it all about road trips and how people were traveling post-pandemic. So Governor, congratulations. Thank you for your continued leadership to push us to perform at the highest level. Being the winner in 2 of the 16 categories is something we're really proud of, so thank you.
Can you imagine really West Virginia winning in 2 of the 16 categories across this nation? It is amazing, and we've put You know, we put phenomenal resources. We believed in it. We believe in it from right now. I still would tell all of you just this, that without any question, we're still we're still just getting the parsley on the plate. The growth is unbelievable with potential that we have in this great state. But Chelsea, what a job. What a job. You know, I mean, our Secretary of Tourism, Chelsea Ruby, unbelievable job. Very, very, very proud of you. Very proud. Well, that's all I've got today. Thank y'all again in every way.